Aloha. Welcome to Return on Wellness, a web series brought to you by Olympian Meeting.
Hello, everyone, and welcome to this episode of Return on Wellness. I am here in beautiful Geneva, Switzerland, joined with my guest today, Dr. Professor, as well as PhD, Bettina, and is it Borisch?
Borisch.
Borisch. Okay, I got it right. We were just having a little discussion that I'd love to keep going because I said, well, do I introduce you with all these credentials? You're a professor, you're an MD, you're a PhD. I appreciate your humility. And you said, well, in Europe, professor outranks MD.
Doctor, yes.
Doctor, which I thought was interesting. And you were explaining, can you explain to everyone else how that works again? You mind running everyone through that?
Oh, well, the academic career starts with a doctorate and goes through several steps. And the end of an academic career would be a full professorship. So that's what Europeans probably look at.
Okay.
In other places, doctor is...
Yeah. Well, because in the U.S., there's so much school
Yeah.
to become an MD that people tend to outrank that. You can go to school for a much shorter period of time and become a professor
Yeah.
without being...
Yeah.
Yeah.
That's it. That's the difference between U.S. system and European system.
Okay.
Yeah.
All right. Well, that's a fun starter. Now let's jump into the conversation. What I'm really excited today to talk to you about is how wellness at events translates to public health. Now, to give some background, you are a MD in pathology, correct? You have authored over 120 papers and 2 books. We were checking your ChatGPT stats before this, I know. But what is your PhD in, and what are you a professor in?
Yeah, I'm a medical person, first of all.
Yeah.
So that's why we're here.
Right?
We are in the health sector, in
Yes.
the border. And I turned to public health from the medical background that I have as a pathologist because I am more interested in health than in disease. As a pathologist, you look at the diagnosis of the cancers mainly, and that's very important work. But at a certain moment in time, I wanted to do more for health than for disease. And our so-called healthcare systems are no healthcare, but they are disease management systems. We take care of diseases and not of health. So that's why I wanted to do public health, because health is everybody's issue.
So you were seeing some of the end results of people not taking care of themselves, and you wanted to get into more of the preventative, addressing it at the beginning, as opposed to just seeing what happens at the end.
Exactly.
I have a feeling there's going to be a lot of snippets from this, and just your statement of our healthcare systems aren't healthcare, they're disease management. That's okay. This is going to be a fun episode. I can't wait. We met at an ICA event, right?
Yeah.
And you used to be were you the president of the board?
Oh, I'm part of an advisory committee from associations.
Got it. Okay. And you were also the executive director of the World Federation of Public Health Officials?
Public health associations.
Okay.
This is the umbrella organization of all national public health associations in the world. So headquartered here in Geneva, the public health associations are per country one group that regroups all the people working in public health, from government to academia to grassroots.
So if someone were to ask you the question, what's the difference between that and let's call it the World Health Organization?
The World Health Organization is a UN organization, so it's a multilateral organization with 193 members now, since the US stepped out. And these are countries and head of states and health ministers who discuss. We are the side of civil society. We are the public health people that work in academia, in every places, maybe also in government organizations, but we represent the broader view on health. There is a government view that is in the UN system where countries come together, and we are the ones who are doing the work in all different places, not only government.
Okay. So I think that's really refreshing because you're getting access to even fresher science and studies and things of that nature because academia is there showing up, representing themselves. It doesn't have to be something that maybe disagrees with someone's political take on something to make it to the World Health Organization.
Exactly. You're to the point. If you ask countries to review on their process in health, you will get beautiful reports. If you do the same study with our members, you will have different results.
Wow. That unfortunately doesn't surprise me. I wish it did, but it doesn't. Okay.
That's why we are important, because we talk about another's view on the health situation.
Yeah, and when it comes to science and data, you need as many options and opinions and inputs as possible in order to ensure you have good data. Yeah. Okay. All right. Well, I really appreciate your perspective on public health. Now, in today's world and events, since we met at an event and you're going to one that's the same week as IMEX, something that we talked about was wellness at events. Events can be a vehicle for advancing health versus disease. And one of the things, your introduction was incredible when you brought me on stage, but you even talked about your own events in your own industry struggles with optimizing for health. So can we talk a little bit about health versus disease management and the determinants of health?
Yeah, with pleasure. Especially I'm from the health sector, so the lot of meetings I'm going to are medical or broader health. And I always say medical congresses are bad for your health. Definitely they are. You sit too long, you eat too much, you have far too many coffees, you have travel there that also makes you sit too long. You're sitting in rooms that are probably not as good for your mental health, and so forth. So every time, and I'm not the only one, we look at events, we say they could be better. But how? And now we have to come back to public health. Health is created where? Health is not created in a hospital. It's a disease. Health is created where people live, love, and work. And so this is what we call the determinants of health. If you go into a place, meetings are also work, that has not the conditions for health, then this is unfortunate. Very, very unfortunate. So there are a lot of things you could do in events because it is a part of your life. If you are an academic or so, you will be in a lot of them. And if you are in a work environment that is bad for your health, shouldn't be the case, especially if you're preaching health. So I was always laughing when I said, again, a meeting, my step count was 2,000 instead of 12,000 usually. My possibilities of moving were extremely limited. The air condition was freezingly cold. I got a common cold or something else. And there are a lot of things that definitely are not good for your health in meetings.
Well, I'm excited to talk about those today. You mentioned health determinants.
Yes.
Can you break those down for us?
Yes. The determinants of health are the social ones. What is your social environment, education, finances, gender? Then there are the environmental ones that are linked to your social ones. If you're better off, you will live in a better part of city. If you're well off, you have more possibilities to do sports, to live a healthier life. And we have the political determinants of health that become more and more important. The way your environment is constructed, the air you breathe, the water you drink, is a political issue. And we used to say health is a political choice. Let's only talk about the buildings, the way cities are conceived. Here in Europe, you can walk in almost all cities. In US cities, it's very difficult to walk, can become dangerous, or there are no sidewalks and so forth. It is already the way, and now we come to meetings, how a convention center is constructed determines how well you will work inside this convention center. So you see, the determinants are very broad, and that's what's difficult about health, because all these factors will influence. But in your case, for events and congresses, you can break it down and pick out the determinants that are on this, let's say, working side.
Yeah, and I think that's why we have our checklists when we're outsourcing venues, right? We're looking for natural light, how walkable, where's the hotel if you happen to be in Las Vegas, do they have to go through the smoky casino or not to get to the meeting space? What are the menus like? I don't know why so many convention centers and things of that nature they put all this beautiful glass on the outside of the building, and then all the meeting spaces are locked in with no windows.
Yeah.
And it's never made sense to me. I don't get it. But I love to find meeting spaces with natural light. It makes it a lot easier.
It changes the mood.
Yeah.
Of the mental health of people. Mental health is determined by your environment and the light and the temperature. Very simple body functions will make you feel well or feel unwell.
Now, you were mentioning earlier about how we keep rooms usually cold. One, because people show up with body heat. You get 5,000 people in a room. It's going to warm the temperature of the room. But two, also to kind of keep them awake. Is a chilly room not good for health per se?
Could you please think of women? Women are not dressed like you. They may have, nothing on their legs. And try to sit 3 hours in a 17 degrees Celsius room with nothing on your legs, I can tell you. That's another issue.
Honestly, that sounds amazing to me.
Yeah, then look at this and in the planning already think of your audience.
Yeah.
I mean, there will be women.
Yes, of course.
Yes, but their needs are not all of this. And I know all my female colleagues saying, oh, yes, you also carry a sharp and you have something to cover your... Yes, because we're all freezing. Always say, why is it so? But this is, the little details. As you said, your list is full of... But, and I would like to come to the concept of meetings, what I always feel as very bad for all of us, it's stuffed with information. Too many talks, too many things, too many workshops. And I've been myself in organizing committees. I'm organizing our World Congress now. People with a goodwill want to put everything into this meeting. And what they do is they overload it and think that the attention span of a normal human being is 40 minutes. And that's already good.
Yeah.
Very good.
That's extensive.
This is really good. So how do you and why do we have another and another and another one? Why don't we think of very good opening thing and then have people react on it among themselves? Stand up, go and say, this crazy guy talked about sports. I mean, have you seen how he looks himself? Blah, 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 blah. Get people digest directly. And that's something that never happens, or very unfrequently. And when there are these little breaks of let's have a little Pilates movement in between, that's not the case. You have to think also of the mental overload that comes with a program packed until the top.
I think at the end of this, you are an MD, so I'm going to have you write a prescription pad for how to rebuild a meeting. No, I'm just kidding. With that, I love that, and we'll dig into that some more. Back to the temperature real quick. Is there an ideal temperature for the room?
No, but it depends very much where you are.
Okay.
Where you are and what the outside temperature is. It's very bad to have a big, big difference between outside and inside temperature.
I've never heard anyone put it that way before.
Yes, but you come out of tropical climate into a minus 18, you will feel shivering cold.
Fair enough.
You come out of winterly Geneva where you have, let's say, 10 degrees and you feel like fine in 80 degrees.
Right. Yeah. Okay.
It's no absolute figure for that.
I think that's one of the things that this whole wellness discussion in general, people need to understand that there's no one size fits all for everyone. Wellness means different things to different people. And also the understanding that, I'm trying to think of the best way to state this. There's a lot of people on social media that make definitive claims. And I think a lot of that is Dunning-Kruger effect, where they know just enough to feel empowered to say something, this is the truth. And it seems like the people who are experts in any given field always say, this seems to be the most accurate based on the knowledge we currently have. And I just want to kind of give a reminder, because you conditioning that in a way really frames that when you see something on social media, the more definitive someone says something is, probably the less likely true it is. Would that be accurate, maybe?
Well, as a good scientist, you know you never have the truth. You're looking for more information every time. Nobody has the truth. Truth only exists in churches and religions. And that there you can believe. But science doesn't work like this. We are constantly looking to improve our knowledge.
Right.
And nobody owns something, and especially not in something as delicate, I would say, as health.
I say every day that we're walking science experiments.
We are doing with ourselves.
Yeah. Well,
We're
because
doing with ourselves.
people talk about biohacking, and I'm like, that's a marketing term.
Yeah.
Because just because it worked for one person doesn't mean it's going to work for someone else. And we're still figuring out, we haven't solved how the human body works definitively.
No, it's a miracle. We don't understand. We understand perhaps 20% of it. The other things, think of neuroscience, the brain. How do we learn? How do we forget? With basic things, nobody can tell you about it. Nothing. So we should be also humble and say, with the bits of information we have, that's what it is. And then comes, and I think you have a very good point, you yourself, if you listen to yourself, we have different bodies. Yeah. I'm small, you're a little bit more trained.
Thank you.
Yeah. We know each other because I know what I like to, when I sleep, you look how you react on different food. You can simply, as you said, do the experiments with yourself. But you have to listen to yourself, understand it, and be true with yourself. And say, well, last night's dinner was really too heavy. I will not have that again.
Yeah. Well, so I've been trying to lean down a little bit. And on my way here, my upgrade certificate cleared. So I got the nice first class seat. And I indulged. I took advantage of all the food and whatnot. I absolutely hated my life when I got here. I felt awful. Yeah. And I was like, oh, yeah, I need to. And I barely ate yesterday because I felt so terrible.
But the good thing is you realize it. Because it was an exception.
Right.
And that's always happening. I mean, you have a real party and you have whatever, but you realize it still. If people come into a mood where they do not realize what they're doing to their body, then it's a difficult situation. Right. So you had an exception, you had first class, okay, fine, and you realized, never again, next time I'll take a little bit less, but you know it, and that's knowledge. Right. That's knowledge that is very precious.
Yeah, well, I think when it comes to wellness is pay attention to yourself and stay curious. Okay, I know we kind of sidetracked a little bit, which is okay. We were talking about the intersection of events and health. And I think one of the things I want to frame this to the conversation that we had when we first met is you said to me, and it's still in my brain, you said to me, you think what you're doing is just wellness at events, but what you're really doing is public health.
Yeah.
That hit really hard for me because I know my credentials. I want to stay humble. When you said that, it made me really rethink what wellness is. And then you just mentioned that medical congresses are bad for your health. So let's talk about how to fix it, shall we?
Yeah, let's try.
I mean, we can talk about it, and maybe someone who has the influence or impact can make it happen. But what kind of things would you change at any Congress, let alone a medical one? And we talked a little bit about the duration of sessions and the attention spans at about 40 minutes max, and then giving people the opportunity to interact. What kind of other things would you do?
Well, we have already mentioned quite a lot. From the health determinant factors is the environment itself, the built environment. As we said, the light, the air, the temperature. And from the side of, I call it more mental, I would say the programming is already very important. How you put breaks, think that people are traveling in time zones. People may coming in if you have a meeting on the other side of the Atlantic, a lot of them coming in, they may have a jet lag. So think of the normal physiology of the human body, and don't ask the human body to do things that are not feasible. Otherwise, you will have a sleeping audience. And it's not due to the Congress. It's due to the fact that half of them are in a jet lag. I've seen that. And it is known before, because you know where your audience comes from, where you have the meeting. So take care, and take care of physiological functions of the body. And then we come to the fact that sitting is the worst disease. We call it now worse than tobacco smoking. So get anything done so that people are not sitting hours in a row. And again, also the attention span while you're sitting. And especially if it's dark and comfortable and you have a little bit of tiredness, what do? You fall asleep. It's normal. The human body will fall asleep. So think of all these factors while you're planning. Try to integrate and say, okay, so what can we do? When is a break good? What kind of break should it be? Can we ask people to walk a little step to go to the discussion room where they digest what they have heard? Have them really digesting what they heard. People go to congresses also for networking, and nothing is easier to get in contact with someone if you heard something. Then you can say, oh, you thought that was awkward, wasn't it? No, yeah. So you feel you have a topic. You don't need to start a chat with whatever. You have your topic. So get these things so that people, what they really love to do is networking. As you know, the factor that influences our lifespan the most is social contacts. So if we are in meetings, we have the possibility of social contacts, but exploit them in a good way.
Yeah.
Good way, and not these apps where you have to meet someone and then this is stressing again. 100 meeting points sorry, I have to go. No, let people get a normal meeting time, feel the person in front of you, and even meet people that you only know from LinkedIn. It's so amazing to see them in live one time.
Yeah.
Yeah, and give them the possibility that, I mean, there is a lot to be done about social contact, I think. A lot more than we are exploiting. Our meetings are great opportunities, but I think their potential is only exploited to 30%.
Yeah, and that's the opportunity. And that's why this show and why I started this agency and why this initiative matters so much to me is because our events are massive opportunities that we aren't fully taking advantage of.
Yeah.
I had a professor on, not last episode, but the one before. Her name is Julianne Holt-Lundstad. I don't know if you know who she is. She wrote, or she was the lead author and scientist behind the U.S. Surgeon General's Declaration on Loneliness.
Okay.
We talked a lot about, and she teaches at Brigham Young University, on belonging and psychology. And one of the key takeaways that she had for events and something that she does with her students is she does facilitated breaks where she provides a prompt and gives people the opportunity to connect with each other in class so that her students can discuss. I think out of everything you said, one of the big things that we can do, because I'm still very much a planner at heart, I like to give tactical takeaway things for people to use. And correct me if I misheard you, but it sounds like while we crank all this content out to people, we're just pushing it. And we're not giving the people taking it in an opportunity to digest it with others. So not only can you help people retain more information by having a post-keynote networking break, but maybe we don't call it a networking break. Maybe we call it a debrief or a discussion where everyone leaves the keynote room and just talks with each other about
what they heard.
And then not only are they probably retaining more information, because they're also going to hear things stated in a different way than it was stated from the stage, right? But then they're also going to create actual meaningful connections with other people.
Exactly. Yeah, you got me completely right. That would be one very practical proposal that I have not yet seen implemented in a Congress. I have not yet seen that, but it would be one.
I think the next time I get an opportunity to do a keynote, I know you saw the one I did, and I tried to do some of that.
Yeah.
I got people talking to each other, at least, at their tables, that I say my keynote is 60 minutes, but it's 40 minutes of content, and it's 20 minutes of debrief, where the last 20 minutes is actually just for the crowd to be with themselves.
Yeah, but another practical thing, if people
Please.
sit there on tables, it's a little bit artificial. It's good if people move, go, and then have small talk kind of surroundings, because otherwise you feel at a school class, you have your working group,
Right.
and you have your post-its and so forth. It's a little bit artificial. So let people get into normal move, get up,
Yeah.
as if they would run for something, and then they are there and can talk about
This is completely changing the way I think about a keynote.
Yeah.
Like 40 minutes of presentation and then 20 minutes of discussion. And
Yeah.
at the end of the keynote, the speaker says, okay,
Yeah.
I'm done.
And I'm with you. We will be here down and go to this room.
We're
I'm
all going to
with you.
stand up. We're going to
I'm with
leave.
you.
Yeah.
I'm with you. And you know how many people after a keynote try to run up to the podium and talk to them, to get them all into one room and talk to the speaker, and then others cannot. And it's always the same scenario.
Yeah.
We don't change it.
Wha-
Yeah.
It's so easy to just
Yeah, it
do
should
what we've
be.
always done.
Yeah.
Well, I'm also going to politely challenge you to take this concept to any congresses that you are a stakeholder in.
Yeah, will be very difficult. We have an international scientific committee, a lot from all around the world. They have all their ways of making congresses. I've been recently in a Bangladesh Society of Public Health. Wow, this was a staff program. Even no breaks, one thing after the other. And the room full, they are used to being overloaded. They're sitting and having one information after the other. So there are different cultures around the world, how to do it. This is from my Western perspective. It's from a women's perspective. That's a point I also would like to integrate, as I am a long-term feminist. I think we have to see that women in meetings may have other needs than men. And this should be integrated as well. Practical things, physiological things.
Do you want to talk about some of those things?
Well, I mean, it's men and women nowadays travel with children, for example. They come to a meeting because they will stay longer for a holiday, so they're already there. Very practical. I've seen that frequently the partner is not allowed into the scientific meeting or has to pay full entrance fees. Get things a bit more open for the fact that people are not only the scientists, but they have a private life, and perhaps the private life is there as well. So that's what my female view on things is. It's very artificial to say, I'm there, I'm there, I'm there. And then everybody runs out, I have to call home, I have to call home. We're putting ourselves in stress like that.
Yeah, we're putting ourselves into sympathetic mode, where we're a subtle fight or flight, which then you're not necessarily as focused as you could be.
Yeah, but, you know, sometimes I have the feeling it's still this idea of the lonesome cowboy. Does it on its own, alone, somewhere. It's not. We are, especially if we want to be healthy, we are a community. And part of the community is private life. So if you're away for, let's say, a week, what happens at home? Or is home there? Or are they at the hotel? Think of that. I have not yet the 100% solutions, but this is something that is not built into congresses until now. It's exciting when suddenly someone comes on with a baby, everybody smiles and finds it nice, but not really part of the meeting.
Okay, I think that's an interesting perspective we haven't had before, but I really like how it ties back into belonging and social health.
Yeah, and people who would speak against would say, you're not concentrated. Yeah, you're not concentrated if you're looking at your phone to see if your 18-year-old daughter calls back from her whatever party. You're also not concentrated.
Yeah.
So concentration is dependent on all the things that you have to jingle, mingle at the same time. Don't like it to call it multitasking, but you have to do a lot of different things. Nobody is 100% only on one thing.
Right.
The focus is only a moment in time. And there is a very good book with an essay that's called The Carrier Bag Theory.
The carrier bag theory. Okay.
An essay that says, author Le Guin, American author who's unfortunately already died, says at the very beginning of humankind, what we did, we collected things. So our first tool was a carrier bag, where to put the... And in fact, our brain is also functioning like that. We're collecting, doing things and having things. To focus on one thing only is very special. Needs attention, needs focus. And the mobile phone has increased this by 100, 200 times. Yeah. Oh, news popping up. I was in Taiwan on a panel, and my Canadian colleague suddenly said, Trump is making it. They have in the audience. We was looking at the news. So that's what...
A panelist on stage pulled his phone out.
No, I was on the stage, and he was in the audience and said, wow, crying out loud.
Wow.
So we are all doing things while we are in meetings. And he was following the news on the election, the presidential election.
Oh, got it. Okay.
Yeah. So that's why he suddenly said, he wanted to give us this information that he got while probably not listening at the panel.
I can guarantee he wasn't listening.
So one thing, I think we have to be honest with us. We are not focused 100% for 2 days in a row.
Yeah, I would agree. Have you seen some of the concerts or events that make you check your cell phone upon arrival?
No.
So there's a trend, because it hasn't caught on yet, but there's a trend where there are certain musicians and performers that when you arrive, they lock your phone up.
Yeah, for several reasons, yes.
And then you get to go to the concert or performance or whatever.
Yeah, right.
Do you think that would ever fly in business events?
Very difficult. Very difficult, but I think we are still learning how to handle our digital environment.
It happens so fast.
Yeah, and it happens so fast. So it's with all new technology that comes into society. First, it changes. It's a technology, but it will change society as well. And it will change the ways we are doing. It already did. March 2020. All people who told me that online working is impossible suddenly were online working. And it changed quite radically. From now on, we have this as part of our working life. That part is online. Yeah.
Yeah.
So the changes come, some very fast, and they definitely will change society, our way of doing. But how we integrate it into existing structures, let's say academia or events making, this is a second question, because now we come to the gritty-nitty parts of how it really integrates into that.
Yeah. Well, I think I'm going to put a challenge out to the audience that if someone can invite people to lock up their phones for a keynote, that's a 40-minute keynote, and then 20 minutes of human interaction afterwards, I think that would really make an impact on a crowd, especially if it's a good keynote who knows how to keep people's attention.
Yeah. I think for a short term, like if you really say this keynote and all of us together afterwards, you can make it. But get like the mobile phones out of the meeting completely.
Oh, yeah.
It will not be possible. But you could have it as a start for a 1 hour and a half thing.
Yeah. Well,
we are going an experiment with you, with all of you. You will be cut off the world for 1 hour and a half. Can you imagine?
Right. Yeah. How many people will be going through withdrawals?
Yeah. I mean, the panic that you have when your mobile phone is not working or you lost it. I mean, you tell them, okay, 1 hour and a half, it's already very frightening.
And we're of an age when we were alive and functioning as human beings without those digital devices.
Yes.
And
but still we are dependent and frightened when it's not working.
Yeah.
When I lost it, when my life is in my phone.
No, it isn't.
And now what do I do? So
because you can't call anyone because you don't know anyone's number anymore.
Yeah. No, so if you would announce that, say, let's make it 1 hour and a half, I think this could be done. But otherwise, longer than that, I feel it will be very difficult.
Yeah. I think that would have to be an internal meeting. That's the only way. Like, if the CEO dictated it.
In an internal board meeting, I would say we do it. We sometimes say, I'm in the board of several institutions where we say, okay, everyone off, flight mode.
Focus.
We didn't come here together for doing what we can do at home.
That really puts such a fine point on the whole thing, on events, on conferences, on meeting. Like, we spend so much money and so much effort.
Exactly. Travel time and time of your life. And then you do Instagram posts that you could do at home.
We have gone down a road I did not anticipate, but I'm completely here for it. Okay, so we're going to switch it up a little bit. Something we talked about is how planners and venues and organizations can think more intentionally about, I believe you called it the ripple effect of their events, and what they do at an event, how that can have a lasting impact on people's well-being. What kind of things have you seen, or what kind of ideas might you have around this about, can events be a spark for someone to start living a healthier life?
There are events where you come back completely enlightened, empowered, and say, I'll do it. Once I'm at home, I'll make this and this. Sometimes in research, sometimes you come back and you say, yes, that was it. If you can create this around health, that would be really, really good. Like the famous take home that lasts, that goes until you are already a week after the meeting. That's a good outcome. That would be a real win. Because I know from content-wise, if you have something where you said, I'm going to continue this, you feel like you were in a very valuable meeting.
Is there anything you've seen really stick with people more than others?
Again, I'm traveling different parts of the world, and things are very different, very, very different. If you're in Japan, there will be different ways and different things people will take back. If you are in the European, North Americans, where we quite know what we could offer and what could be taken back. But I think we have to be very cultural sensitive, especially if it's an international or world congress like we are doing. And we will have a lot of indigenous people taking part, so they have completely different views on what is taking back and how it should be taken back. And if you look at the organization, already if you have a lot of indigenous people in a meeting, they will change the meeting room. They will sit down differently. Or I was in Brazil for the Public Health Association of Brazil. The health minister was invited, and they have a second health minister both on stage. The indigenous people of Brazil came and did music before she started to talk. She had to wait, and people in the room started to chant. It gave me a very, very interesting take back. And it was not what I have thought, but I came back and said, yeah, why are we sitting silent? And why are we having Minister of Health coming in, going out? This is sterile.
Yeah.
We are in a meeting, we are not in a diplomatic meeting where things have to be codified. We could allow ourselves more openness. And if you have meetings in other places with different people, I think you have to really, for the legacy, for the take back, for the take home, look what is there already. You cannot give a take back from the Finns to the Maori in New Zealand. That's not possible. You will first have to create the community and then see, okay, what I learned from Maori meetings, a lot. Absolutely not like we meet. Absolutely not. When they had their new king now, the lady king, how this happens, not as we would elect someone.
Right.
Yeah. And so think of in terms, I know the word is forbidden now, diversity that exists around this world.
It's not forbidden on this show. You're safe. You can say it here.
No, I would always use it. Because diversity is a normal word of English language. It's, by the way, Latin, and so, sorry, a Latin word, we cannot claim that these Romans didn't know what they wanted to say. we are all different. And if it's a World Congress, which I'm preparing, think of the differences. Think of what the ones and the others expect and would do. And why not have a part organized by a group that has a different way of doing? It's a learning for the others.
Yeah. It gives you the opportunity to experience a different part of the world without having to go to that part of the world.
Yeah. And learn other ways of doing, because we are codified in our meetings as if there were only one way of doing.
That's the beauty of travel. I think that's one of the things. And
of meeting people really. Yeah, meeting really, not just sitting in an audience and sitting on a row and then going out. No, meeting them really.
Yeah, if you're just sitting, some friends of mine call it sit and get. Because that's what the lecture is, right? Yeah. And I really wish in the US we would tweak our language a little bit and call some of these talks what they are, which are lectures. We don't use that term because it sounds terrible, because nobody wants to get lectured to. But that's what it is when it's someone on stage for an hour just talking at you. It is a lecture. So I wish we would be a little more acknowledgeable to that. But you brought up a couple really interesting things. And one is that when you're organizing a global event, you have a lot of things to keep in mind because there are going to be a lot of different requirements from different people. One of the things that we've really been trying to remind people is that when you are thinking about wellness at an event, as the event organizer, you can't tell everyone in attendance what you think wellness is. You need to ask. If you're going to offer physical activities or things of that nature, survey your audience. Make wellness part of the registration so that people can weigh in and they have an understanding of what wellness really is about, or what they can determine what wellness will succeed at the event, because you'll understand how many people want to do what. Yeah. It's very easy. It's going to make your life as a planner a lot easier as well. I think the other thing that you brought up that was really interesting is kind of goes back to the late Anthony Bourdain, who would talk about go to a different country, eat their food, experience their life, because the old adage of variety is the spice of life, right? Okay, let's use a slightly different word. Diversity is the spice of life, because when you have different perspectives from different people, from different countries, from different environments, you have a better understanding in general of where to find the best things. I think that's one of the reasons that the United States got the reputation it had for so long, is because if you think back to like the Olympics, it was like the all-star team. Because there's a country song that talks about like Italian leather and Greek food. Basically, like, we got the best of everything from all over to be in one place, and because of diversity. Yes. So our events, and as planners, it's important for us to get out and see different things so that we can bring the best possible options to our participants. Yeah, and nowadays we are a global community. The world has done nothing but shrunk. We have become closer and closer, and that's why we are a global community. Yeah. And we have to really embrace it. Well, and to understand how global of a community we are, we can go back to February or March of 2020 and see exactly how fast something like that spread. That's how small this world is. That's why we just have concluded a pandemic treaty for the 193 member countries to be better prepared for the next pandemic that will come anyway. There's a pandemic treaty? Yes. Concluded and will be voted in May at the World Health Assembly. Oh. Yeah. Because this was a world event, and if we don't manage it together, it wasn't managed all together. We tried, but we have to really be better prepared. So, pandemic treaty concluded now and will be voted in May in the week of the World Health Assembly by the 193 member states. Well, I look forward to hearing about that. What would be great is, because by the time this airs, that will have been voted on, so you can let me know what happens. Yes, and it will be. Yes, you will know. We can put it in the comments. Yeah, we can say has been voted. World Health Assembly, May 20th, so-and-so. Okay. Agenda point XYZ, yes. Love it.
Yeah.
Okay, we are starting to creep up on time here.
Yeah.
I'd love if you had some examples or ideas for creating more, I'm going to say the word equitable, accessible, and health promoting event environments. So what can we do less and what can we have more of?
I think we've talked about already. Do more with less in terms of content. We talked about this point, and you mentioned it very nicely, the community to be integrated before you start. Get your audience to be known before you start, and don't put things on them that they didn't even ask for. Then in the planning, think of the different needs that people will have. People are all different, so very important. And also always be very kind. Be kind to your audience, be kind to your speakers. Do not push them into schemes and things they have to do, but give them the space to create themselves, their congress, their meeting. It's difficult, but it is something we can do because we have now a lot of technology. We have a lot of intercultural exchange where we can say, okay, why didn't we? Could we? Who is willing to do that? And so forth. In terms of diversity, I've seen very practical that a lot of associations, federations, groupings have now their young so-and-so, which is very good, to have no ageism, get the different parts of life together, young ones until very old ones, and be prepared to this kind of diversity. As I mentioned, be prepared to the fact that men and women may have children and partners and so forth. Be prepared that wherever you go, things can happen that are specific to the place and that others have never seen. So, yeah, preparedness in a certain way. And don't forget the mental health. We are not robots who just function. We are with moods and we can get angry on little things. Take care of the mood, and I would say mental health in meetings as well. And we had the practical things that influence mental health, but also the content things that influence. Yeah, and if we're coming close to an end, I have one point that I really would like to make, and it's from my understanding, never exploit it. The meetings we are doing, especially international ones, are serving for peace building because we meet the real people from different places. And by knowing someone, you cannot really go into, this is my enemy. You have talked to him. You know that talking to someone creates a link. And I think this point, I've talked to ICA people and others. I said, you know, I advertise that a meeting is part of peace building. It's building a humanity that comes closer together.
So meetings aren't just public health, they're also peace building.
Public health and peace is one. You can only be healthy in a peaceful world.
Fair enough. I think I don't have anything to add after that. Appreciate the mic drop moment at the end. I love that we're speaking the same language, even though we use different words. One of the things I remind people is to meet, or that I remind planners, is to meet your participants where they are.
Mm-hmm. Yeah.
And that people need white space. And when you overprogram, it's not going to work out well for you. Right. So thank you so much for sitting down with me today. I really appreciate it. Your insights are incredible. And yeah, I hope we can keep pushing the industry forward to build a healthier world as well as a more peaceful one so that everyone can enjoy their meetings to the fullest extent.
Yeah, because it's an important part of our lives.
Absolutely.
And we want to enjoy life.
Yeah.
Thank you so much for having me.
Absolutely. Thank you. All right. Thanks, everybody, for joining us today on this episode of Return on Wellness. We will see you next month.
Thank you so much for joining Return on Wellness. For help integrating these ideas, please scan the QR code. We sincerely hope you join us for our next episode of Return on Wellness.